What do you really want Congress to do and focus and prioritize in order to help young people get the attention and help they need well before those 11 years average it takes to get mental health assistance?
Like you can't necessarily legislate your way out of stigma. That's a cultural change we all have to play a role in. But where Congress can make a big difference is in focusing on expanding access to treatment, making sure that we are integrating primary care with mental health services, that we're expanding our pipeline for mental health professionals, and we're doing that in a diverse way. Because right now, only 2% of the 41,000 psychiatrists in our country are Black, for example, which is just a reflection of the lack of diversity we have in our mental health workforce, and that has direct implications for providing care. But lastly, Congress can play a role in investing on the prevention side as well. We actually know from the data that people who are struggling with mental illness and who are people of color are often less likely to go and seek out help, even if that help is available to them. So that stigma really matters. We've got to recognize that to close the equity gap, we also have to measure, how we're doing. We've got to track, whether people have equitable access right now, and if they don't, and they don't right now, how do we make sure that we are holding ourselves accountable to making sure we're making progress?
Well, let's stick with that thread of equity and talk a little bit about masks. I know you were speaking before the committee about the eventual rollback of mask mandates and, light at the end of the tunnel. But, why now?
The general sort of view of this, I think, is that as the pandemic gets better, we should be pulling back on restrictions. The conversation now is about what should determine when that happens. And it's likely going to be some combination of the hospitalization rate or hospital capacity itself, which is about healthcare staffing, about the death rate, and also just about where we're going in terms of cases. Are we on the rise or are we on the decline? This is actually the evaluation the CDC is doing right now.
Can you see a near future where Americans won't have to wear masks? Are we talking this summer or the end of 2022?
I can imagine that future. I can't tell you if it's coming in a couple months or in 6 months or in 12 months. I can't tell you exactly, but what I can tell you is that to live that future, we are going to need the tools that we've been building over the last year. We're going to need readily available vaccines and therapeutics, and we're well on the way to having the supply of therapeutics we need. We're going to need those freely available high quality masks and tests. And we're going to also need the right mindset, recognizing that COVID is not going to disappear overnight. We may see waves of old or new variants, but if we have these tools, if we're using them well, particularly our vaccines and boosters, we can protect the vast majority of people from hospitalizations and deaths.